person that was, back to osteoporosis and osteopenia, there's someone that was diagnosed with osteopenia.
Yes.
And can you explain to them what osteopenia is and how it can develop into osteoporosis if it does progress?
No, it's a very important question. So osteopenia can be a lead-in to osteoporosis. This is to say, it doesn't mean all people with osteopenia necessarily become quote-unquote osteoporotic. Let me give a parallel. Again, as I mentioned, sports medicine partially correlates to this talk. There's something called female athlete triad, and this is where, if you will, for example, a competitive runner, young woman, has an exceedingly high mileage per week, let's say over 40 miles per week. This action can actually inhibit certain hormones which prohibit estrogen and progesterone from doing their job of depositing or maintaining bone integrity. In female athlete triad, their bones tend to become weaker, become osteopenic, and they have a predilection for fracture. It's very common, actually. Again, you'd be surprised how many of these people run as they do. Where does the spectrum change here? So why does it even matter when we talk about these different terminologies as they relate to bone? Well, because the treatment is different. So, you know, not to turf this into a zone of trying to get out of the question, but osteopenia's treatment is a bit controversial because a lot of it goes back to why a person has it. So take the correlate of a runner. Tell them to stop running. And then they will normalize their menstrual cycle, because what happens in female athlete triad is that they lose their menstrual cycle because they have inhibited their release hormones from the brain that go and stimulate the ovaries. In which case, they tend to come back and osteopenia will resolve. That's a different situation. For a person who actually has outright osteoporosis, I know it's a question on there related to Fosamax, or alendronate, which is the pharmacological entity. There is explicit different treatments for that, and I know it also comes into the issue of how do you screen for this. Yes, there are different bone density measures. One is, you may have heard, called a DEXA scan. There are more rudimentary ones, which can be done on the ankle, for example, to get a sense about where a person's bone density is. So I hope that was helpful.
Yeah, that was definitely helpful. The Fosamax, you mentioned the Fosamax, and people say that it's a drug that you have to stand when you take it. Is there a specific reason you have to stand, and do you have to?
So it's, I think, a very good question, and here's why. Because, you know, no medication goes without some kind of side effect. You may know this medication has a black box warning on it, and it is for esophageal cancer. The reason this is, I believe, said that people should stand is they do not want this medicine to sit at the lower esophageal sphincter, which is just before it enters the stomach, because of trouble it may cause there. Alendronate, or Fosamax commercially as it's known, is useful. But I would say one thing about this, in particular as it relates to osteoporosis. I think those interventions are not as helpful unless and until a person has an adequate vitamin D level. Do know over half of our American population is vitamin D deficient. It's just the fact. And we know different levels of even being quote-unquote normal versus, I don't say super normal levels, can definitely distinctly affect bone health. And this is because of the latitude we live in, and the fact that we are not out even in the sun when the sun is available to us. So we're indoors during business hours for the most part. Most of us don't run around naked in the sun. Yeah. So we don't get the vitamin D that we need. So the discussion of Fosamax or alendronate, as it relates to why should you stand when you take it, I believe that recommendation came because they didn't want it to sit at the bottom of the esophagus because of that black box label warning, which is to say that esophageal cancer is something to be known that's happened in context of it, and they have to say it. That's one. Is it useful? Yes, it's shown to be effective for osteoporosis. Is it the only treatment or one and only way with which to go for someone who has this problem? I wouldn't say so. In fact, I'd like to say, as a person in practice, to the extent that I can avoid any pharmacological intervention, I prefer to, which is to say, going back to this part of vitamin D being part of a way I'd like to see if you can start to turn the tide of osteoporosis backwards so that person doesn't have this. I'd make one point also. For young females, I think this is really important. Women, or young, I should say, all the way from, frankly, infant to toddler to childhood to adolescence, up to age 12 is the point in time where you have the opportunity to deposit the most amount of calcium into your bones. After about age 12, the game's largely over. You don't have the ability to deposit as much in there. This is an important point because if a person right out of the start actually hasn't had a sufficient amount of deposition of calcium into the bones is an issue. And we can talk more about this as relates to diet, because there's some things which actually, how can I say, make the bones weaker dietarily later in the context of a lupus patient, I think are pertinent. We can cover that at a later point if you want.
Yeah, that we would definitely like to. And for lupus patients, we have, because we can't be in the sun, there is a vitamin D deficiency that's extreme in most of us. So do
Sure.
you recommend, like a lot of them, people have said that calcium and vitamin D
Sure.
are what their doctors recommend.
Oh, let me again, yes, put it in the landscape of the fact that even people who don't have lupus are at least half of our population is vitamin D deficient. This is to say, although I don't myself, I'll be straight about this, have a known deficiency of vitamin D. I myself put myself on 5,000 international units 5 days a week. I'd rather be on the side of liberal with it than short of it. There are a whole lot of other host of reasons for this. They relate to longevity, they relate to mental acuteness, they relate to a myriad of other benefits. But absolutely, I think probably all of us in northern latitude should be on a vitamin D supplement, and a reliable one at that, I should say, because there's a lot of things, by the way, do know that supplements are not FDA regulated. For example, if you and I went down the street over to Safeway and picked up a bottle of vitamin C and it said 500 milligrams vitamin C, we are taking it a bit on faith. It may well have 500 milligrams of vitamin C. It may not, because they're not third-party verified, which is what they call pharmaceutical grade. For this reason, those which are third-party verified pharmaceutical grade supplements, I encourage, if people are going to buy these things, that they look online and find the ones that have that certification, because then you know two things. One, what it says it has, it in fact has that. And further, there's no other adulterants in there that would otherwise not be accounted for because of the verification from a third party. So it did not try to necessarily plug the company, but one that I think that is an outstanding, from where I buy my supplements, is called Pure Encapsulations. They're located in Massachusetts. There are other such companies, I'm sure, just as good, but I think this is important because people feel, hey, I gotta go buy my vitamin D. They don't really realize, I'm not to cast aspersions over the Costco brand or any others. They may all well have what they say, but you don't actually know that.
Yeah, that's good to know.
Yeah.
That's really good to know.